Chair, you do have quorum. So we're ready to go.
Good morning, members of the MAG Human Service and Community Initiative Committee. As a reminder, please turn your mics on and clearly state your name before speaking to ensure that members of the audience can hear you. And please mute your mics when you're not speaking to eliminate any feedback noise. A voice vote or recall vote or a roll call vote will be taken for each action item on the agenda. Phone-only attendees need to press *6 to unmute themselves. We will now begin the meeting with a roll call of all members. Kelly?
Thank you, Chair. Please turn on your video when you are called so we can see you for roll call. Thank you. Wally Campbell. Allie Klein.
Sorry, my video is not working, but I am here. Thank you.
Thank you. Tina Condi.
Here.
Thank you. Monica Dorsey. Jen Duff. Christine Ellis.
Here.
Thank you. Barry Graham. Thank you. Janine Guy.
Present. Also,
here
I
now,
have
sorry.
so I can't do video.
Thank you. Bill Patena. Kathy Tilkey. And Chair Joel Navarro.
Present.
Did I overlook anyone? Okay, thank you, Chair. You have quorum.
Okay, thank you. Call the audience. MAG provides the opportunity for members of the public to submit written comments via MAG website. Comments received 2 hours prior before the meeting will be shared with the committee members in advance of the meeting. An opportunity for public comments on the agenda was provided ahead of the meeting. Kelly, do you have any public comments?
Yes, Chair, we have 2 public comments today. The first was received from Lieutenant Governor Monica Antone with the Gila River Indian community. She said she would request a meeting with tribal leadership regarding the sober living home crisis and the regional pathways programs. Chair, we have addressed this comment. The second comment is a person in the room, Melissa Armis. If you'd like to come up to the microphone, you have 3 minutes for your public comment.
Good morning. Thank you for the opportunity to share the work and vision of Mercurio Analytics. Mercurio Analytics is a Venture Madness 2023 finalist, tech startup, and the creator of the all-inclusive data and analytics platform, Mercurio T4. It integrates disparate systems across different agencies, effectively breaking down data silos and fostering a unified approach toward public service delivery. It's a comprehensive data and analytics solution designed to empower agencies with real-time, secure, and compliant data. We're tackling a multitude of issues, from substance abuse and trauma to human trafficking and children's services. While mental health faces many challenges, we are centered on an inclusive approach using the recovery-oriented model to help government bodies manage these issues. We've been awarded an Arizona data management contract through the state, through the Arizona Commerce Authority, making it super easy to engage with us. And we also have the required operational partnerships already in place, like Caresoft, all those things. We're currently in conversations with local governments in New York, Pennsylvania, and California as well. Our founders are experts in the field of data analytics. And our board is lucky to have renowned professionals like Dr. Arthur Evans, the former Philly commissioner at BDHIDS, and also the current CEO at the American Psychological Association. And we also have Dan Paolini, the former CIO of the city of Philadelphia. Gathering actionable data currently takes around 30 to 45 days, and we want to make this something that happens real time. But does it work? We've had a pilot program actually with the city of Philadelphia with their BDHIDS service. And they, in the first year, they saved over $110 million and significantly improved life outcomes and actually decreased homelessness for about 40%. This is a platform. It has many different uses. One of them is homelessness. And there actually you can go from a high-level dashboard overview, and within 2 clicks, you can actually go into people-specific information. So it's useful not just for the agency providing services, but also for law enforcement. Our mission is to help cities and counties turn service recipients into community contributors. And the idea is that agencies can leverage those critical insights and work together and help identify at-risk individuals earlier. Thank you.
Thank you. Any more public comments? That is it.
Thank you.
All right, we're going to go ahead and do the approval of May 11th, 2023 minutes. Are there any questions before we request motion of the approval of the meeting minutes? Does anyone have questions? Seeing none, I'm going to go ahead. Hearing none, we have a motion. Do we have a motion for the approval of meeting minutes?
Ally
First-
Klein from Surprised, I so move.
You're gonna second?
Councilmember Condi, I second.
And we have a second. We will have these participants in the meeting online take a part in the voice vote by turning on their cameras and unmuting their audio. For those who cannot do that or do not wish to turn on their cameras, we will conduct a roll call vote. Members, please leave your cameras on until we do the roll call vote. So can I have a voice vote from the members online? Those in favor say aye. Those opposed say nay. And we'll go ahead and do that.
Aye.
One at a time, or we do it all at once? Okay, all at once. All in favor?
Aye.
All opposed? Seeing none, that carries 9. Oh, okay. Well, 10. Yes. Staff,
Yes, you have to count us all.
let's see. Staff, can you take a roll call of members participating? We did that. Okay. Let's see. Kelly, do you have any actions, motions? We're good. Okay. Approve of May 11th, 2023 meeting minutes. We'll go on to item number 4. And Kelly, I guess you want to start on that?
Yes, thank you, Chair. I just wanted to take an opportunity to welcome our new leadership for the next year. We do have Chair Joel Navarro from City of Tempe, and we also have Vice Chair Tina Condi with Avondale, who will serve as vice for the leadership. And I wanted to thank them both for the extra time it will take over the next year to lead this group. We really appreciate it. And we do have several new members also who are joining us today. So we thought we would give everyone an opportunity just to briefly introduce themselves. And we'll start with you, Chair.
Yeah, go ahead. Thank you. Yeah, first of all, I'm Joel Navarro. I'm a council member in Tempe. Been on the council for approximately 15 years now, and currently in another election cycle. I'm also a Phoenix firefighter. I'm a deputy chief for the Phoenix Fire Department. I presently oversee the Sky Harbor Airport and all the fire apparatus and stations in that area. And it's a wonderful world working for a city like Sky Harbor, which is a city, and many other cities for like the city of Phoenix. So it's kind of fun, and I'm enjoying my position as it is currently placed right now. I do get moved around quite a bit. But yeah, that's me. And I think, Tina, do you want to start with her first?
Thank you. I'm Councilmember Tina Condi with the City of Avondale. I was appointed to serve in 2017, and I am currently on my second and final 4-year term. And I look forward to serving, and I look forward to co-chairing this group along with Chair Navarro.
Thank you. I do appreciate it. Next up. Let's see.
If I may, Councilmember Christine Ellis from the City of Chandler. I replace our Councilmember Vice, currently also Vice Mayor Mark Stewart on the committee right now. a little bit of my background so that I can put it into context why I took this appointment is because for the last 22 years, I've been really working in that space of working with those experiencing homelessness, specifically in the area of the zone, which is Madison and 12th Avenue. It started with me with an organization that I created for us to work in that area. Living in Chandler, I didn't have that opportunity, but I went to Phoenix to be able to do it. I will say my goal right now being here is to see something getting done. I don't get on committees just to have meetings. I'm a very action-oriented person. I want to know what our goals are, where we're heading, and what is it that we need to do. So in the context of what are we doing, why are we doing it, and how we're going to do it, and then I can take it and run with it. So I appreciate everyone, MAG, giving me the opportunity right now to serve. Thank you.
Thank you. Can't see on the screen, but anybody next?
Councilmember Klein?
Hi, I'm Councilmember Klein, and I'm in the third year of my term. So we'll see what happens next year, but have been on this committee for a while, and I'm involved in a number of things that have to do with Health and Human Services. I'm on a couple other MAG committees too with Tina. Hi, Tina, and and enjoy seeing how I can support MAG and how MAG can support our cities.
And what city are you with, Councilmember?
Oh
Klein?
yeah, I didn't say that. Oh, how rude! I'm with the city of Surprise.
Thank you.
Perfect.
Thank you. Councilmember Dorsey?
I'm Monica Dorsey. I'm a council member in El Mirage. I have been on the council since 2018 and I'm in my second term now. And I don't know that there's any more to say than that right now.
Thank you. Councilmember Graham? Jeremy, can you go to gallery view,
Can you hear
please?
me?
Yes, we can hear you now. Thank you.
Councilmember Graham, happy to be here with you all. I'm from the city of Scottsdale. Just got elected a few months ago, and we've all been, people that are new, we just finished about our first 6 months in office, and very happy to be here. My predecessor, I think, was either Kathy Littlefield or Betty Janik or Solange Whitehead, one of those three. And I'm interested in learning from you all, and appreciate you having me. Thank you.
Councilmember Guy?
Good morning. I'm in the mountains of Washington State right now, which is why I have horrible connection. So I apologize for that. I am a council member from the city of Buckeye. I've been on council for 7 years, but I also worked for the city of Buckeye in the community services department for a number of years. So I also oversaw our social services department. So I'm very anxious to serve on this committee. I also serve on the CDAC committee and have also done that for the last 7 years. So thank you for giving me the opportunity to join this committee.
Thank you. And Councilmember Tilke? Oh, you are muted, Councilmember.
There. Sorry, I hit the button, just didn't work. Good morning, Kathy Tilke with the town of Gilbert. I'm currently serving as vice mayor. Ran for office after retiring from the Gilbert Chamber of Commerce as CEO for 25 years. Probably my interest is I was able to get our council support to create a community engagement task force, which we're trying to identify gaps in services for different topics that we've never really talked about before in the town of Gilbert, such as domestic violence, homelessness, low income, human sex trafficking, and a couple others. And I think my goal here is to learn from all of you who have had much more experience than I have, but also, you know, what is it that we can do together? And very much like Christine, where I'm an action type person. And so I really want to see what we can do to make a difference. But at the same time, understand that each of our communities is different. And we have to keep that in mind as we move forward. And just really appreciate the opportunity to be here. Thank you.
First, thank you guys for being on this committee. I've been on the committee for several years now, and obviously with my background in the fire department, and I know Councilmember Christina Ellis being over at Cass in the Cass area, collectively about 10 years of my time was at Station 3, so I was plenty familiar with Cass for a number of years. But I have to say, this group, this committee, collectively, is, in my opinion, is an extremely important committee. I think that we do have a chance with this committee to actually move, the football, so to speak, because we do have collective issues across the valley when they talk about mental health, homelessness, drug addiction, and affordability and affordable housing. I think those are some real key topics that we talk about in every community. And I think that we have an advantage as a group to really make headway in a good direction regionally. And that's my hope, chairing this committee throughout the year, is to make sure that we can collectively share our ideas, find the best practices out there, but also advertise it, also be able to communicate about it. I think our residents and our constituents, at least I know in Tempe, what are we doing as a city? What are we doing as a region, and how regionally we can help each other? I mean, when we talk about homelessness, City of Phoenix alone can't just handle homelessness. City of Tempe alone, City of Scottsdale alone. This is a regional effort that we all have to take part in to collectively do our due diligence and to make sure that we're managing and being able to provide the services as needed and do it efficiently. And I think that as a group, working with our cities, working with our programs, we can collectively do that here at this committee. So I'm excited about what we got going on. With that said, I'm going to go ahead and move on. Item number 5 is the Regional Affordability House Public Education Campaign. On December 8th, 2021, the MAG Regional Council approved a Pathway Homes Regional Homeless Action Plan for local tribal governments. One of the activities included in the plan is the development of public education campaign to increase acceptance of affordable housing. In April 2022, the MAG Regional Council provided input on the early materials developing for campaigning and partners. Since that time, MAG has worked with the Home Matters of Arizona, their consult Javelina, and other partners to develop the campaign. Draft marketing strategies was shared in November 2022. The campaign named and visual identities were shared in March of 2023. The toolkit referenced during the March presentation has been completed and is now available for us for use. Local and tribal governments are encouraged to promote the campaign. Regional media buys will begin this fall. Kelly Taft, our communication director of MAG, will present on this item, and we'll have a presentation.
Great. Thank you so much, Mr. Chair and members of the committee. I am so excited to be here today to share the campaign toolkit for the Home is Where It All Starts campaign. I just have to say I was very happy to be involved today when I was able to learn more about each of you and all of the very important and great work that you are doing in your individual community. And the work that you do will tie in directly to this campaign. And throughout this process, we have worked directly with our member agency PIOs and a number of committees and other stakeholders to get input and feedback into this campaign, which informed the creation of this toolkit, which is now available for download on the homeiswhereitallstarts.org campaign. So we really want to thank you for your feedback and your participation, and we hope that you see some of the feedback that you provided reflected in this resource. You can change the slide, Jeremy. So we'll go back just real quickly to revisit kind of the purpose and mission of this campaign. The why is a future where every Arizonan has a place to be at home, empowering them to live stable, and purposeful lives. The what is to inspire Arizonans to be champions for communities where everyone has a home that meets their needs, and those needs may be different. The target group that we are ultimately serving are Arizonans experiencing barriers to find a suitable home in their community. One of our key goals is to offer decision makers resources and support so that they can overcome obstacles to housing in their individual communities. This includes shaping and sharing the narrative to create new perspectives among constituents, to educate on the value and impact of attainable homes, and to provide information on data and policies that put homes within reach of everyone in their communities. And finally, providing information and data on those policies. You can go to the next slide. So it's very important, of course, to hold ourselves accountable, measure our progress, and keep focused on tangible outcomes based on our long-term and short-term goals. Our long-term vision is to ensure we are reshaping the narrative. I know we have talked before about the importance of moving away from using the term affordable housing due to the negative connotations associated with this verbiage, and make sure we're talking instead about homes that are within reach, homes that meet our needs, and affordable rents and mortgages. How are we going to measure success? Well, we'll know when we are successful when our new framing is being used by all stakeholders across the state who are advocates for attainable housing, that we're building a coalition of support among our key audiences, and when agencies and stakeholders are actively pursuing a diversity of attainable housing options so that fewer Arizonans are experiencing barriers to stable housing. Go to the next slide. So to make our long-term vision a reality, we have 3 objectives, more for the short term. The first is to transform the narrative and focus on meeting community needs. So goals included in creating the toolkit of materials were to create a central and unified message. Other goals are to ensure that stakeholders are sharing the message with their networks. So we are relying on you to help us with that. That media is using the campaign language and covering housing issues, and that the majority of our target audiences have seen our materials at least one time, with a portion of them seeing it 6 or more times. Our second objective is to create a network of supporters for housing solutions that meet people's needs, which includes creating new champions who are actively engaged in conversations at their local level or within their own sphere, and that they are promoting housing that is attainable. And that key decision makers are receiving support from community members when housing decisions are being made in relevant meetings. Our third objective is to make housing options that fit people's needs a reality, and that fewer people will face housing insecurity. And so some of those goals underneath that objective include that developers are aligning their plans with the campaign recommendations and focusing on meeting people's needs rather than cost and profitability alone. More homes that are affordable, accessible, available, and sufficient for people's needs exist in Arizona communities. And then our vision is being echoed by stakeholders across housing, health, transportation, education, and other impacted sectors. You can change the slide. So some of our strategies to help meet these goals. Strategy 1 is to foster collaboration. And we have received great collaboration so far. We are hoping that you can help open doors in your circles of influence. So that's really important to us. Strategy 2, it's very critically important to tell real stories so that we are letting people know exactly how the lack of affordable rents and mortgages is impacting people throughout the communities. So we are hoping you can connect us with some stories with your clients that we can feature on our website. And we would love if you could help share those with us, and you can send those directly to me and connect me with anybody that you think might be willing to share their story publicly. Number 3 is to expand the campaign messages. The toolkit will include pieces to share, and we will get into that in just a little bit. You can change the slide. So we have both partners and stakeholders. Partners are the organizations and individuals working in housing, homelessness, or related fields who are promoting the campaign to maximize our reach and impact. Our stakeholders are the 4 priority groups that we have identified as our key target demographics. and they can be most impactful in making meaningful change. And that includes HOAs and similar groups, elected and community leaders, developers, and likely voters. The next slide, please. So how can you get involved? Well, we're asking you first to please get involved. You have been our partners along the way. So the more that you can share our messaging and the toolkit with stakeholders and help us promote this campaign locally as well as regionally, we're looking for active leaders to collaborate with us to develop those initiatives. And we will be conducting regional media buys this fall to help augment that message to the public. And we I greatly appreciate the funding we've received to date on that. Next slide. So how can you engage? Well, some of the best ways to engage are to use the narrative within all of your internal and external communications. Again, no longer referring to affordable housing, which unfortunately is stigmatized and creates in people's minds a certain type of housing or a certain type of neighborhood of housing. And so instead, we want to refer to things like homes within reach, homes that meet our needs, and affordable rents and mortgages. We're hoping that you will help add content to your own website so that you can help amplify the toolkit and share email and social media content. The next slide, please. So you can help us promote the campaign in several ways. One is to support paid ads. We have raised $105,000 so far for paid media buys. We have also contributed along with some other partners toward a Cox integrated partnership. Again, that's being funded by a number of partners that cost $150,000, but in return, we are getting $300,000 from Cox and collateral for them to assist us in the media buys and assisting us with that development of that website. Understanding not everyone can provide money. Other ways is to help promote the campaign by contributing to building and maintaining the directory of resources and data. The more that we can offer to folks, the better. That can be used by stakeholders. Identifying real stories in your communities, mentioned that earlier, so that we can capture and develop content. That would be very of huge assistance to us if you can help us with that. You can go to the next slide, Jeremy. You can also help by becoming a member of the steering committee. It meets monthly. You could become a trained spokesperson for the campaign, and then you can also just help us customize outreach opportunities in your own sphere. Next slide. So for the toolkit, which again is now available for download, we do know that narrative change can take some time. So we have tried to make this easy to have ready to go materials that you can use in your communications. As our partners doing this work on a day-to-day basis and communicating with stakeholders in your daily work, you are helping us reach our various stakeholders. Next slide. So this is just a list of all the things included in the toolkit. I'll go through those one by one so you can change the slide, Jeremy. So the toolkit includes an introduction letter with calls to action that you can send to your constituents. It contains specific ways for different partners to support our efforts. This includes adopting language that more accurately reflects the housing crisis and its impact, allowing us to change that narrative. And we'll go into that further in the next slide. The intro letter also describes how partners can support our efforts by sharing the message and how you can collaborate and work alongside us to take an active role in YIMBY, which is yes in my backyard, and make housing options that meet everyone's needs more readily available. And you've heard me say this, you can, thank you for changing that. Affordable rents and mortgages, homes that meet our needs, homes within reach. Again, those are just a better way to frame the conversation due to, again, some of the stigma with affordable housing. Next slide. So the toolkit does include some sample web copy. It contains a brief overview of the campaign. It contains calls to action. You can use as much or as little of the web copy on your website. It's up to you. Next slide. Sample mass emails and best practices. It introduces your audiences to the campaign and encourages them to learn more. The second highlights specific actions they can take to support the campaign. But if you do want to develop your own emails and sort of your own communications, the toolkit also includes tips and best practices to keep in mind. Next slide. So there's also sample social media posts and again, best practices that you can rely on in terms of amplifying that in your social media. Next slide. There's some digital ads and flyers. So if you have paid advertising options available to you, you can certainly run those digital ads. If there are any, again, specific stories that you want to tell, and MAG does have a staff photographer who's an intern that is available. If you need help developing your own ads, we are more than happy to offer his services. So next slide, please. So again, to get the toolkit, you can download it from the web. So if you go on the website, homeiswhereitallstarts.org, you fill out a quick form, and then it comes back to you as an email. Give it about 30 minutes to generate, because the assets obviously are very large files for some of the ads. So that's why they want you to fill out that form, and then they'll email you a OneDrive link where you can go and download all those materials. So thank you again for your participation, your feedback, and your support. And please let me know if you have any questions.
Any questions from any committee members?
Great, thank you.
Mr. Chair, this is
Go.
Councilmember Ellis. I have a question.
Yes.
Ms. Ironwood. You might have probably mentioned it. It's probably embedded in all your what you just presented to us. But how do we quantify? How do we measure the success of this campaign? What is it that's going to tell us that we are successful when we implement all of those things?
So I think that it was talked about a little bit in the long-term vision. There are some specific measurables, like we want to make sure that our stakeholders have seen the message as at least up to 6 times. Right now, so we're going to continue to phase in our approaches with our measurements, but one way is to ensure that we start seeing that change in the narrative, that media is using our new language, that we are getting that attention, that this is an issue that's impacting not only those experiencing homelessness and chronic homelessness, but also workforce housing. The increasing cost of rents and mortgages is becoming more and more difficult. We have vulnerable adults. So we really want to start kind of measuring who's downloading the toolkit. That's one of our measurements, is we want to make sure that we know that people are actually downloading and using it. So it'd be really helpful if you can do that from the website, because that helps us track those numbers. Again, making sure that people have seen the messaging at least six times. So those are some of the short-term goals, and then we will continue to measure success. Another thing that's really important to MAG, because our member agencies are made up of cities and towns, is to ensuring that we have people willing to support when they are making housing decisions at their council meetings, so that we have people who are there to speak out in support of those. So it's not just the folks who are the NIMBYism folks who are there. So that they really feel like that they are supported in the decisions that they are making to provide affordable rents and mortgages, and also to working with those other stakeholders, developers and HOAs, to really start to create an understanding, as well as helping change the narrative surrounding affordable rents and mortgages.
Any other questions?
This is Ali from City of Surprise. I want to say I really like the idea. I really am hopeful that we can help change the narrative in this area. It's hard sometimes for folks to see that this isn't a handout, but a hand up to help people get into the next level that they need to do to be living a very positive lifestyle. So I'm really looking forward to see how we can utilize this in the City of Surprise. So I know Kelly will send all this detail as to how we can contact you out to all of us. And I'll be having conversations with others in our communications department and in our area, so we can see how we can utilize this in Surprise. So thank you.
Great, thank you.
Mr. Chairman.
Yes.
This is Councilmember Dorsey. I just want to express my appreciation to all the folks that worked on this presentation and all the work behind it. I think it's very nicely put together, makes a lot of sense, and will be something that will be referred to by many folks as time goes along. So I appreciate it, and I'm going to work on my vocabulary. Thank you.
Thank you.
Any other questions?
Yes, Chairman, this is Janine Guy from the city of Buckeye. I was curious, I noticed that developers were mentioned a couple of times in the presentation. And how directly involved are the developers and what is their commitment to this? I don't know if you know, but probably the city of Buckeye has more planned different styles of housing on the books right now, maybe more than any other city right now. But it's our developers that have our first contact with our citizens. And so I was just wondered how invested they are in this plan.
I do know we have a few on our steering committee. Again, I think that's open to others. I know Dominium has been very, very actively involved in helping us with providing some input back into how things are stated, but they are considered one of our top 4 target audiences. So we really are hoping to engage that development community so that they recognize the value in this work and that it's not just about profitability, but also providing balanced housing options so that there is a wide range of options for folks in terms of getting attainable homes.
Any other questions? Seeing none. Couple things come to mind. Obviously, this is, something that we're going to get sent out to us. So it's kind of, we'll have that email to reference. Kind of see it, and I think it was mentioned, connect yourself with your social services, your fire, your police departments, the people that are on the streets that Care 7 for us in Tempe, for City of Phoenix, it's our crisis response vans. You guys might have your connections within the city. I think this is probably a good information to kind of also hand it to those people within those areas so they have an understanding about this. Great information for your PIOs to help you out with your piece of newsletters, opt-eds, whatever it may be. I think this is probably a good piece of information that you can utilize to help you and your city, but also help the group that is providing the service. And I think it's kind of the slow process of changing that narrative. You do have opportunities, especially when you come to presentations in your work meetings, to talk about these plans too, to utilize it in maybe one of your subcommittees or a presentation to the council. I think even a presentation to the development review committees when they talk about or when they approve, different types of development that's going on in various cities. This might not be a bad presentation if that is allowed just to those groups so they have an understanding and those committees have an understanding, because collectively, I think as a council, you want all aspects to have an idea of what the council priorities are. And if I would assume affordable housing within every community, having that balance is something that we need to strive for. So this is just a tool, in my opinion, that you can get that information out. So, flag that email, get your resources within your cities to do a warm handoff about the information, get your PIOs to help you out, your council aides, whatever it may be, and utilize it on your social media. I think this is a great platform just to do that very quick, spend a little time on it, and it's done, and you kind of get it out there, but it's something that you can get familiar with and broadcast.
Thank you, Mr. Chair. And I would mention that we have had along the way, we have a regional public education campaign working group made up of most of our member agencies, PIOs. So hopefully they will be familiar with it when you do mention it to them. We provided this presentation to them last week too.
Very good. Any other questions? Seeing none,
Will we have, Mr. Chair, sorry, this is Councilmember Ellis, will we have the toolkit emailed to us through MAG, or do we have to go directly on the website to get it?
through MAG. Kelly will send it off to each
All right.
of us.
Thank you.
And if you can download it from the website too, again, that does help us with tracking, but we will send it. But it's also great the more that you can go to the website to download it, because that is one of our measurement goals as to how many
Yeah.
people are utilizing it.
Yeah, just wanted to sit down with our community services director and her team and go through it to see what is it that how we can put it, our force behind it and push it through for our area.
And I would assume in that package, if there's any questions, your information or contact. Yep. Okay. All right, good stuff. Thank you, Kelly. Appreciate your time. Okay, we're gonna move on next. Sonora Prevention Works improves the lives of people who use drugs through street-based outreach, organizational capacity buildings, and statewide advocate work. They believe everyone should have access to knowledge, tools, and community they need to be safe and healthy. Healy Coles is the co-founder and executive director of Sonora Prevention Works and will provide an overview of the organization. He is committed to the achieving health equity among people impacted by drugs and drug use and drug policies. And we have a presentation for her.
Hi, everybody. Thanks for having me. My name is Haley Coles, and I am going to be talking with you all about harm reduction in Maricopa County as a strategy to address the overdose crisis. I got my date wrong on this slide, should be the 13th. Next slide, please. So just a bit about me. As was mentioned, I'm the co-founder, I'm the executive director of the organization. I have been doing this work since 2010. I have been paid to do it since 2017, which is when we were really able to get the ball rolling on our program. I'm an alumna of the Robert Wood Johnson Foundation Culture of Health Leaders program, and I've provided subject matter consultancy for the CDC and NASDAD, particularly around the health of people who use drugs. I am born and bred Arizonan. I attended Arcadia High School in Phoenix. I got my bachelor's and my nonprofit management certificate from ASU and my master's in public health from U of A. And previously I was the board chair of Aunt Rita's Foundation, which is Arizona's HIV and AIDS foundation. I have personally been practicing the concept of harm reduction since 2005, which is when my journey with chaotic drug use began. And previously I worked in Tacoma, Washington, setting up a hepatitis C screening and health insurance navigation program for the needle exchange there. Next slide. So at Sonora Prevention Works, our mission is to build a healthy Arizona with people who use drugs. And we do this from the micro to the macro. So at the micro level, we provide direct services to people who use drugs. We distribute safety and wellness supplies at our syringe service programs, also known as needle exchange programs. We conduct workshops for people who use drugs, in particular, women who use drugs and women who may be pregnant or parenting. At the meso level, we work with organizations who work with people who use drugs to increase their ability to do it from an evidence-based standpoint and to incorporate harm reduction. And we've worked with a lot of organizations across the state to set up overdose education and naloxone distribution programs. And then at the macro level, we have written and introduced legislation since 2016. We've had 4 bills passed that improve the health and safety of people who use drugs. So most recently in 2021, we wrote and passed legislation that legalized needle exchange programs and that also legalized fentanyl test strips. We are the nation's largest distributor of naloxone. You may also know it as Narcan. It's the opioid overdose reversal medication. And we've only been able to do that through our work at all three of these levels, the micro, the meso, and the macro. Our headquarters are in Tempe, but we are a statewide agency. We have staff in 7 counties, and the counties where we don't have staff, we provide support through mail order supplies and then remote assistance for organizations. Next slide. So I'm here to talk with you all about the overdose crisis, and in particular, how it's impacted us in Arizona and in Maricopa County. So this chart is looking at increasing overdose deaths from 2017 to 2021. The orange bar is Arizona. The green line is Maricopa County. And as you can see, Maricopa County makes up over half of all of the state's overdose fatalities, and it has been increasing at a pretty steady trajectory along with the rest of the state. We have been experiencing an increasing overdose crisis for actually the last 40 years, but around 2015 is when it really shot up and we started seeing the most drastic increases. And unfortunately, we continue to see those increases. I think one thing that's important to note is that from 2019 to 2020, we saw a much sharper increase than we had seen in previous years. We were starting to maybe level off a little bit on these overdose death numbers, but then COVID hit. And we know that overdose is very much impacted by social and environmental factors. And so COVID hit, people lost their housing, people lost stability, people who may have been in recovery or previously not using, began using again. We saw a lot of people in isolation, and the nation has still struggled to get a handle on the overdose crisis, although the worst parts of the COVID pandemic have ended. We've also seen a shift in the drugs that are contributing to these overdoses. So when we saw this first skyrocketing in about 2015, it was prescription opioids. And so you all are probably familiar with all of the campaigns that were done to reduce prescribing of prescription opioids. And what did we see? Well, we didn't see a decrease in overdose death. We saw people who were previously prescribed opioids who were still dependent on those opioids, whether for pain management issues or because it is a physically dependent medication, who just switched to heroin. And when we're buying drugs off of the street, we don't know what's in it. We don't know what the purity is. We then saw a shift to fentanyl. So what we're seeing in almost every overdose in Arizona is either synthetic opioids, which is fentanyl and fentanyl analogs, or polysubstance overdose. So we're seeing, it's very rare actually that we're seeing just one drug in a person's system. People are taking multiple drugs, but they may not know that they're taking multiple drugs. They may think that they're taking cocaine, but it may be laced with fentanyl, with xylazine, with all kinds of other substances that are contributing to these overdoses. It's also important to keep in mind that the overdose crisis doesn't just impact the people who experience the overdose, right? All of these people who experience an overdose have families. Many of them have children. And that's then contributing to this next generation of traumatized children who are growing up without a parent. And we know that when children experience adverse experiences as children, it increases the likelihood that they are then themselves going to struggle with chaotic drug use, that they're going to have negative health, social, and behavioral impacts for the rest of their lives. So this really is a community issue that impacts everybody. Next slide. So this statistic is, I think, really important to keep in mind as we're trying to figure out what we do. So a lot of people say, well, we need more treatment beds. And that's true. We do need more treatment. We need it to be more available. We need it to be culturally relevant. We need it to be easy to access. We need it to be affordable or free. However, according to the National Survey on Drug Use and Health, there are 40.7 million Americans with a substance use disorder, and less than about 3% of those people think they need treatment. So 97% of Americans who have a substance use disorder do not believe that they need treatment. So increasing access to treatment is not going to be helpful for that 97% of people. It'll be helpful for the 3% of people. And if people see that it is more and more accessible, it is more and more attainable, maybe this percentage will decrease and we'll have more people who are interested in accessing treatment. But the question is, what do we do for the 97% of Americans with a substance use disorder who don't think that treatment's going to solve their problem? And that is where harm reduction comes in. Next slide. So harm reduction is a set of practical public health strategies that are aimed at reducing preventable death and illness. We first saw needle exchanges in the US in the 80s at the height of the HIV crisis. There was an acknowledgement that people are still using syringes, whether we like it or not, and regardless of the risks. So if we can provide people with sterile syringes, then we can decrease the transmission of HIV, and that helps the whole community. And so that's kind of where we saw harm reduction start in the US, but it's now been widely embraced by public health officials across the country and across the world. Harm reduction understands that abstinence is one of many possible goals. Most people who are using drugs don't want to stop. They may want to reduce their use. They may want their use to be more managed. They may want to be able to show up to school, to be able to show up to work, to be able to pick up their kids. But abstinence is not the only goal for a lot of people. And so when we see programs that are emphasizing only abstinence, we're not taking a look at the majority of people who are actually struggling with substance use. And so with that in mind, harm reduction aims to meet people where they're at by supporting any positive change. An example of this is somebody going from using 5 times a day to using 4 times a day. If they're using syringes, that is 1 time less a day that they're at risk for HIV, hepatitis C, or an injection-related wound. That's 1 time less a day that they're at risk for an overdose. And I don't know about all of you, but whenever I try to make a change, it doesn't happen overnight, and it happens very slowly, and it's bits and pieces at a time. And so harm reduction meets people where they are to help them continue building on the ability to make positive change. Harm reduction is not just these public health strategies, but it's a framework for how we consider individuals and communities who are impacted by drug use. Harm reduction accepts that whether we like it or not, drug use is a part of our world. It is a reality. It has always been a part of our world. And so it's not ignoring the real and sometimes tragic harm and danger associated with drug use. I have had friends and family members die of overdose. I have had staff members die of overdose, right? This is very serious, and we are not minimizing the tragedies that can be associated with substance use. What we're trying to do is to take a reality-based approach, to take things step by step, day by day, to reduce the likelihood that somebody is going to die or experience a long-term illness. We're taking a different approach, and we're acknowledging that drugs meet important needs for people. Okay, next slide. So with that in mind, that concept of harm reduction in mind, here's how we approach overdose prevention. And this is widely endorsed by SAMHSA, by the White House, by the World Health Organization. So we can start off with prevention and safety messaging. When we tell people just say no, we are withholding information about how people can actually increase safety if they are using drugs. So some tangible prevention and safety messaging that is important to let people know is to not use alone. When people use by themselves and they experience an overdose, there is nobody there to call for help. So if a person is going to be using, whether we like it or not, we can encourage them to use with another person to keep the door unlocked. There's a hotline called Never Use Alone that people can call into, and volunteers will stay on the phone with that person. If that person becomes unresponsive, they will call 911. We want to tell people to go slow, especially after periods of abstinence. We see a lot of overdose happening when people get out of jail, when they leave treatment, because we know that substance use disorder is a chronic relapsing condition. People don't often just stop once and that's it. They return to use over and over again. And so if we know that that is going to happen, because that's the definition of substance use disorder, we can tell them this information. Hey, I know you don't want to use again. We all hope that you won't use again, but if that happens, don't use as much as you used to because your tolerance is decreased and you're at an increased risk for overdose. We also want to tell people to avoid mixing substances when possible. So these are reality-based messages that we can give to people who are already going to be using so that we can hopefully reduce their chances of experiencing an overdose. Drug checking is also incredibly important with our fentanyl overdose crisis. We're seeing that so many people who are dying of fentanyl overdoses do not know that they're taking fentanyl. So we work with a lot of people who know that they are taking fentanyl, and they're not the ones who are at as highest risk for overdose. It's people who don't know that there's fentanyl in their substances. So we encourage drug checking. Fentanyl test strips became legal in 2021. And so it takes 30 seconds for a person to test their substance to see if fentanyl is in it. What we have seen from the thousands of people we've given these strips to is that sometimes people will say, whoa, 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 I don't want fentanyl. I'm not going to take the drug. For other people, they are still going to take the drug, but they take less. They make sure somebody's nearby. They make sure that naloxone is nearby. Again, these are harm reduction strategies to make sure that a person can stay alive. And then there's naloxone or Narcan. I think I mentioned that Sonoran Prevention Works is the largest distributor of naloxone in the nation to community members. We've distributed over 800,000 doses and we've had over 25,000 lives saved. The CDC recommends that the priority population for naloxone is actually people who use drugs because they are often the first responders. People who use drugs are with other people who use drugs when they experience overdose. So we are trying to put naloxone into the hands of every person who uses drugs and then into the hands of family members, friends, agencies, anybody who may be in a position to assist in the event of an overdose. And we give that all out for free. Next slide. So for those who are interested in connecting with harm reduction and connecting with Sonoran Prevention Works, some of the places that you'll see us out in the community are at our syringe service programs. We have weekly fixed sites. We're finalizing some new sites. I think we've got 6 weekly sites in Maricopa County, and they're spread throughout the county. We provide on-site rapid HIV and hepatitis C screening and confirmatory testing. We also have a mobile heat relief and AccuDetox van. At these sites, we distribute safer use supplies, hygiene and wound care kits, food, water, and more. We know that a lot of the people that we see we're the only service provider that they're interacting with because we're not telling them that there's something wrong with them that they need to change. We're telling them that we love them no matter what. And we want to give them the tools that they think are best to keep themselves safe. And as a result, we have made thousands of referrals to outside care because people trust us. So just from January to May of this year, we've engaged over 3,000 unique individuals and we've made over 3,000 referrals to outside care. Syringe service programs have been shown to increase the likelihood that somebody will access treatment by 5 times. So when a person asks us for a referral, they're asking us because they're ready and they trust that we're going to give them a referral to a treatment center that's going to meet their needs. So they are more likely to actually go and engage in treatment than if they just tried to on their own. And we also know from national data that these programs decrease crime in the communities that they're at because we are helping to meet people's basic needs. We also partner with various community agencies to operate our fixed site. So currently we are co-located with Community Health Center in Guadalupe. We are working with a laundromat in Mesa, and we're working with several behavioral health agencies throughout Phoenix. Next slide. So I mentioned at the meso level, we provide workshops and training. So some of those workshops for people who use drugs, we do a perinatal harm reduction workshop series. I can't think of a group that is more stigmatized than pregnant women who use drugs, right? Substance use disorder doesn't just go away when somebody becomes pregnant. We know that there are people who are pregnant who continue to use substances. So we have these workshops to try and support them. We also do a harm reduction 101. We do workshops on HIV and hepatitis C prevention. And we also have a community advisory board where our community members who use drugs tell us what they need. And then for agencies, we provide trainings and workshops. We do an overdose prevention, recognition, and response training. We have that actually pre-recorded on our website, so anybody can view that. But we also do regular public community trainings, as well as customized trainings for various organizations. And that's a list of just a few of the trainings that we offer. Next slide. So in considering how to partner with us, there are a lot of different ways. We know that there are people using drugs and there are people experiencing overdose in all of your communities. So we utilize partners at our outreach sites. We like to provide as many wraparound services as possible. We're in conversations with a medical school to have medical residents come out and do some wound care consultation for our participants. We are working with some agencies that have mobile healthcare units to come out to our sites. Then mobile medications for opioid use disorder, so people can actually get started on those medications right there at the syringe service program. The training and technical assistance that we conduct, I mentioned that already. And then volunteerism, 90% of the kits that we give out, including the naloxone kits, are assembled by volunteers. So we are always looking for volunteers, especially groups of volunteers to help us make kits. We also have volunteers who come out on outreach with us. We train volunteers to conduct HIV and hepatitis C testing as well. Then we do some advocacy and research. So on the right is a list of just some of our partners in Maricopa County. It would take many slides to list all of our partners, but one of our 4 organizational values is collaboration. We know that we cannot make meaningful change in this state on our own. And so we deeply rely on partnerships with other organizations and other communities across the state. Next slide. So if anybody is interested in connecting with us, these are some of the topics that folks often connect with us on, and these are the ways to reach us. For naloxone and harm reduction supplies, so we have a program that's called Harm Reduction by Mail. And so for people who can't come to our outreach sites, or people who are in counties where we don't have outreach sites, we will actually mail them naloxone and other harm reduction supplies so that they can stay safe. We also provide some of these supplies to organizations. So we have a statewide network where we send out free naloxone to basically anybody who wants it. So you can take note of these email addresses. I'm also happy to make sure that these are shared with you all later on. Next slide. And that's it. So here's our basic contact information. I really appreciate you all giving me the space to talk about harm reduction as a strategy to address the overdose crisis. And I welcome any questions that you have.
Thank you. Appreciate that. Any questions from our committee?
Yes, Chairman, if I may, Councilmember Christine Ellis, I have a couple of questions for Ms. Cobbs. The first question I wanted to ask is, with my background being in psych and soon to be an NP, how does your organization get people who are mentally unable to make decisions that are really, I will say, sensible, or even able to make those kind of decisions, make decision that you just mentioned just now, to not call somebody when they are about to use? I mean, they are in active addiction. How do they take the time to decipher, now I'm going to use, then I need to plan my using time, or I need to, because from my understanding, when someone is high, they are mentally altered. How do you get them to really use the principles that you have described to us?
Yeah, I mean, we see people who do use these principles all the time. So I mentioned that we've had 25,000 overdose reversals reported to us. 90% of those overdose reversals were performed by people who use drugs. So they are able to save people's lives. They're able to take these steps to be safe. I can tell you, when I was in active addiction, I was going into pharmacies. I was asking to purchase sterile syringes. I was trying to take care of myself. Just because I was actively engaged in a substance use disorder didn't mean that I didn't want to take care of myself. And I was denied sterile syringes at every single pharmacy that I went to. So we are trying to create an environment for people where they can take care of their needs. You know, a lot of times it's not about the choices that people make, it's about the choices that they have. And for a lot of people who are struggling with a substance use disorder, they don't have a lot of choices. So we're trying to increase options for people. At the end of the day, we can't control anybody, but we know that this works because 90% of those 25,000 lives saved were saved by people who use drugs.
All right, the last question that I have for you, what is your funding source? Where do you get reimbursed? Who reimburse you, and how does that work?
Yeah, we partner with Access, utilizing federal funds from SAMHSA.
There we go.
And then we also work with various foundations and individual donors.
All right. Thank you so much. Appreciate you.
Any other questions? See none. Ms. Coles, thank you so much. One question, I know the needle exchange program, this is just one topic that's come up within our city. How do we get, when they do the needle exchange, to bring needles back? We have seen the program actually help, but then we've also seen the program actually increase needles in our desert parks. We had a whole mess of camps of where individuals were using, but they weren't bringing the needles back. Is there, I don't know, any incentives for the individuals to bring some back, or how do we work around that? Because that's been one of the biggest issues.
Yeah, I think that's a really important topic. And of course, nobody wants to see drug use paraphernalia out in the community. I know the program you're talking about. That's not our program. But you know, it's been widely regarded that programs should not withhold syringes from people who can't bring them back. So in the early days, there was this concept of 1 for 1. You give us 1 needle, we give you 1 needle. That was found to not reduce HIV or hepatitis C, because at the end of the day, a person needs a sterile syringe, right? So it's important to note that that programs aren't often going to withhold, even if people can't bring them back. But like I said, it's about the choices people have, not the choices people make. And people don't have a lot of choices for sterile syringe drop off. So we talked with the county many years ago about setting up sterile syringe drop boxes in public places. So if people have access to be able to dispose of these syringes more readily, that can help. That's really like an environmental thing that needs to happen within the community. But you know, we also give people small little Sharps containers that they can keep in their backpacks, so that they can fill up those Sharps containers and then dispose of those properly. It is an ongoing issue, and it's not just the needle exchange. It's an issue that the whole community needs to address. You know, we are trying to prevent individuals from transmitting HIV and hepatitis C and dying from an overdose, but we also need community to support to make sure that there are enough options for people to safely dispose of those syringes.
Perfect. Thank you. Any other final questions? Appreciate it, guys. Thank you. And thank you so much. I mean, this is great information. We'll have this information passed out to everybody out there. Great campaign for everyone, you know, on this topic, especially when we talk about opioids. I've been very passionate in this area for a number of years. And I think there's some great headways that, you know, collectively we can work together on making some differences within our communities. And I think this is just one resource, along with many other resources that we can help utilize to make some change. So I hopefully more on those topics and those discussions throughout the year as we go forward. Okay. With that said, we're going to go ahead and move on. So the next item is item number 7, is the request for future agenda items. Are there any requests by the members for future agenda items? Anything that interests that the Human Services and Community Initiative Committee would like to have considerations for discussion, or even an update? Or, you know, I know that there's been many topics that have happened throughout the committee. You know, I'm sure they have resources of updating us on that. But is there any topics that you guys would like to have for our next few meetings?
Chairman Councilmember Ellis here. I know as I go into the community, I meet a lot of other council members and mayors and vice mayors who wanted to know what we're doing here in Chandler, because we have a program called Navigators. And that program is 98% to 99% successful for us when we have engaged with someone that is experiencing homelessness, in not only through our mental health court system that we put them through, but also the fact that we do wraparound service and then end up getting them in housing within a period of time that is very minimal than the past that people have been seeing. If the committee will be willing to hear, I could speak with our director to see if we could do a presentation about what does that program entail and how did we able to implement it. Why we started with one and now we have 7 navigators, and those navigators are those also who have been experienced, just like our previous speaker, who have experienced homelessness, have experienced drug addiction. They go on the street to interact with those people and then be able to foster a safe environment with them, a trust with them, and to allow them to be able to help them. Because I think that's what it's going to take when we start having that trust and people be willing to say, because nobody wants to be an addict. Nobody says that I'm going to use for the rest of my life. I don't believe that. And I don't think that's the truth. I think people want to live a life normally. Traumas happen, things happen, and then people find themselves in those situations. It's hard for them to leave those situations, but it's not something that they grew up saying that when I grow up, I want to be a drug addict. It's definitely not the case. And so if you will be willing, or any members of the committee will be willing to have a presentation from our team, I would love to explore that and see how we can bring that information to you all as best practice sharing. Evidence-based also sharing.
That's outstanding. Kelly has noted that down, and I'm sure we'll reach out and try to get that information out so we can have a presentation. Sounds great. Anybody else? Any other future agenda items out there that want to be discussed? Anything in your community that might be happening that affects our committee and share with? Okay. Seeing that, one thing that came to mind, and Kelly, I don't know if there's any information collectively from this organization, is what are some of the programs that the cities are doing for affordable housing? And what cities are doing some sort of program for affordable housing. I think it's more of a just to see the programs that are out there. Maybe some basic information on, how many people they have affected, how many people they've actually placed, and then, some possibilities of any issues that might be, hindering them. Not enough, would be probably the big one. But some basic general information just on affordability from every city around our community. And if a city's not doing a program, maybe we can highlight that, but they probably do have a program, and maybe it's just something we have to update on.
As our Director of Communications, Kelly Taft, mentioned, we do have a local jurisdiction committee also as part of the continuum of care work, which is our homelessness work here at MAG. And we have individuals from multiple municipalities come together monthly to talk specifically about housing and issues as you're describing. So we would be happy to take that to the committee and ask for volunteers for those presentations.
That'd be great. Thank you. Okay. Anything else? Seeing none. Item 8, committee for comments from the committee. Are there any comments or announcements from the members? Anybody have any announcements? Going once, going twice. Well done.
Sorry.
Go ahead.
Chair. Oh, this is Councilmember Condi. Just a comment. I know that the Arizona League of Cities conference is coming up in August, and our next meeting isn't until September. So I just want to welcome everybody. I'm going to be there. So please, if you see me, please come up and introduce yourselves. I'd love to meet you guys personally and just chat and visit a little bit and get to know each other. In this first meeting, I just got such a sense of that things are going to move forward with this group here. I feel like it's a very powerful group, and I was just listening and I was just very encouraged. And so I just want to just say thank you for your input. I kind of was quiet this time around because I was just very honored to be a part of this group. And I just think it's important for us to support, encourage, and cheer one another in our successes, right? Oftentimes we don't share what those successes are in our story, in our cities. But as we continue to share, I think we can all glean off of one another and know and learn best practices. And again, just really be here to support and encourage each other in our walk, in our council walk. So thank you all. I hope to see you guys in Tucson in August.
Perfect. Thank you so much. Anyone else? Let's just say, Councilmember Condi, I think you hit a home run there. I think for sure that, as I said, I think this committee does have the ability to really actually make some action going forward. I think that's probably one of the positions I think that we need to strive towards is the implementation and seeing that within this first year that we actually can make something and drive something forward regionally. And I think the League of Cities is going to be a great place just to meet everybody there, and also just to network within other communities and kind of share some ideas over there. So utilize those resources. And like I said, these presentations today are information that we can utilize not only to showcase our city or your cities on what's going on, but collectively what we can do to work together. I think it's a great opportunity, especially the first presentation when you talk about affordability and trying to find housing and stuff like that. Those are hot agendas on everybody's plate right now. And I think that utilizing those resources, those toolboxes are tremendous assets for us. But once again, get your PIOs, get your community service people, get the people around you to help you out. I know that as council members, some of us have jobs on the side, maybe others don't, but it depends on how, we can work towards those things, but you do have resources out there to help everybody out. So I think that's perfect. Well said. I'm very encouraged about this committee myself, and I'm looking forward to the presentations as we go forward. I think there's a lot of good information out there, but there's a lot of things that we can do collectively to move the ball. So I look forward to that. With that said, we are going to be adjourned, and I'm going to give you back a lot of time, maybe 15 minutes. So you get to go to lunch. Thanks, guys. I appreciate it. I like to run a crisp meeting, and I appreciate your time and candor, and we'll see you guys in September. Thank you.
Thanks, everyone.
Thank you.
Everyone.
Bye-bye.